Okay. There's an overseas device manufacturer and you want to private label their product. You want to sell it in the US. They're a device manufacturer and you want to sell their product in the US, but you don't want anybody to know that they make it. You want them to think you make it. So you're going to private label it. It's going to be your name, your brand on the product. Can we help you? Yes, of course we can help you. But there's a few things that we need to know before we can help you. That's what this video is about. So, number one, what's your device? Depending on what answer you give me on what your device is, it could be a completely different answer. If your device is class 1 device and it's exempt from a 510K, that gives me a very different answer than if it's a class 2 device. It determines whether you need a specifications developer, you need 510K clearance. Those are things that we need to check depending on what the classification of your device is, and not just whether it's class 1 or class 2, because there are devices that are 510K exempt that are class 1, and there are devices that are 510K exempt that are class 2. And there are class 1 and class 2 that also require 510Ks. So you have to know the specific device. So that's number one. I need to know what device you have. Number two on the list, I need to know whether the manufacturer that is supplying you the product, are they going to be importing it to some other company? So you're just a distributor, or are you going to be the initial importer? That makes a big difference. If you're going to be the initial importer, you got to pay money because the initial importer has to be registered with the FDA. That's a $7,653 expenditure every year. So if you want to pay almost $8,000 every year to register with the FDA, then you can have that right to import the product from overseas. Now, that might be helping out the company overseas a lot if they don't have an importer yet. But if you're going to spend that money, you might also want to be asking for you to be the exclusive importer. If you're going to spend the money, you should get that. That would make sense. But that's something you have to negotiate with them. That's not something that's controlled by the FDA. All they require is whoever imports it has to be registered and has to pay the money, and it's not prorated. So if you're making this decision around this time of year, April of 2024, it's only going to be good until October 1st. October 1st, you're going to have to register for 2025. So whether they have you as the importer or whether you're just a distributor, that's a key question. The next question that I usually want to know is, are you going to be changing the packaging or the labeling in any way, shape, or form? If the manufacturer overseas is putting the label on for you, that doesn't necessarily mean that you don't have any responsibilities. But by them putting it on there, they're doing all the label control, and they're going to actually put on their device listing, they're going to actually put your brand. So whatever brand they're going to put on that product, that's going to be on the device listing, and they're going to print it out for you. Whatever the label is, it's going to say that. So they have to control that label. So they have to have the label control procedure. They have to print it. They have to verify it, inspect it, all those things. And whatever label they're putting on there, whatever brand that is, it's got to be on their device listing. But it's possible that you might be saying, we already have an art department. We already want to design the label for you. We're going to review it. We're going to approve it. We're going to send it. All you have to do is print it. They still have to have label control, but conceivably, you could have a design control process and control the content of the label. You could even decide that you're going to use your UDI and not their UDI, and you could get your own GUDID account, which makes it even harder for somebody to tell that it's your product. I'm sorry, it's their product that you're distributing. So by having your own UDI, your own GUDID, your own brand, your own label design, everything, you make it more yours. But that comes with a cost. Now you have to have a quality system to manage all those things. And you're now essentially the repackager, relabeler. Even though somebody else is doing the work, you're the one designing it, controlling it, approving it. So you're now the relabeler. And whoever's designing that label and approving that label and assigning that UDI, they're going to have to be identified as the repackager relabeler. Otherwise, the FDA won't give them the GUDID account so they can do that properly. So they want to know who that barcode is for. And every company that has a product coming in, they're going to have that UDI. Another thing that we want to know is, do you have a quality system? So you could have a part of a quality system. You could have complaint handling. You could have distribution records. You could have, I'm trying to think of what else, reporting requirements. There are different procedures that you could have in place, but maybe you don't have a complete quality system because you don't design or manufacture anything. You distribute things. You market, you sell, you take customer complaints, but you don't manufacture anything at your location. So in this case, you would only have a partial quality system. If you're going to take on the role of repackage or relabel, you're going to need more of a quality system than a company that doesn't. And another thing you have to consider when you're working with foreign manufacturers is they need a U.S. agent. Anybody that's in the U.S. doesn't need a U.S. agent. All it means is this is the person that the FDA is going to contact by email and by phone if they can't get a hold of the manufacturer overseas. So they send an email to the U.S. agent and they send an email to the manufacturer's correspondent. So whoever is listed as the official correspondent for the manufacturer on their registration, they get an email and the U.S. agent gets an email. That could be the same person. So we have clients where we're the official correspondent and we're the U.S. agent. So we get both emails. But they have to have a U.S. agent if they're located outside the U.S. So a lot of companies go with Registrar Corp because they're the largest U.S. agent firm out there. They cost about $1,500. Our firm, when we first set up companies with U.S. agent, where we provide that service, it's $600, and then renewals are $450. But you know they have to have a U.S. agent, and you could be their U.S. agent. Somebody else could be their U.S. agent, but they do have to have one, and it has to be on their official registration for the FDA. So those are usually the first questions that I'm asking a company. I want to understand, what is the relationship, what are the roles, what is the device, so I know what laws are going to be applicable and what things are not going to be applicable. You have to decide if any of these roles are going to apply to your company if you're going to be importing a product and distributing it for somebody. So are you going to be the initial importer? Are you going to be the complaint file establishment? And are you going to be repackager labeler? You have to decide each of those roles. You could just be an initial importer, but those three things have to be decided. And you should really have a distribution agreement that says who has what role. Things that you might want to think about, things to consider if you're going to enter this, is who will have the UDI and GUDID account. Most people don't want to deal with that hassle, and they want the manufacturer to have it. So then you're not a repackager or labeler. If you're a repackager or relabeler, you're going to have to do that. A lot of people are like, we don't want to deal with complaints. Well, if your name's on the label, they're going to call you. So that's not really an option if you have your name on the label. Now, you could have an agreement that says, we're going to take the complaints, we're going to keep a record of them, but we're going to hand it to you, the manufacturer, to do the investigations and the CAPAs. That would be an acceptable arrangement, but you're going to have records that you've received it and passed that information on to them, and you need to make sure they're actually doing it. Because when the FDA comes, they're going to be like, well, you're distributing this product, we get these complaints, but nothing's been reported like it's supposed to be. You want to think about, what are you going to do if there's a recall? If there's a recall of the product, you're going to have distribution records, which you have to have anyway, but you're going to have to provide that very quickly for the specific lots that are being recalled. And you're going to have to identify what locations those went to so somebody can create a mail merge list and send off letters of the recall to those companies. And there might be some liability associated with that. So you might want to be thinking, does your supplier have liability insurance? It's not a requirement. In Europe it is, but in the US, they don't have, you shall have liability insurance. So if I'm going to be distributing the product for somebody overseas, I want to make sure that I'm indemnified and there's a liability insurance that lists me as one of the people that are covered. I don't want to have to cover you for your mistakes. So those are some things to consider. Now, best practices. If I want to private label a product, um, you want to check out those things. Do they have the 510K clearance? Are they registered? Have they had any complaints? Have they had any adverse event reports? You can actually look up to see if they've had any. You could look online and see if there's any complaints, like people review products and say how good or not so good they are. Those are things to check out. You could see if there's anybody else distributing the product, anybody else that's the initial importer for that company. And that may change your decision on how you want to negotiate with that company. But you definitely want to have an agreement in place. You want to define the roles. So, are you going to be an initial importer? Are you going to be a complaint file establishment? Are you going to be repackager or relabeler? And is this going to be exclusive or not? So that's a key question. They don't have to agree to make it exclusive. They might want to leave that option open, and that might change what you're willing to do and what you're not willing to do. Um, the price of the product has an impact on that. So if you're going to be a private labeler, make sure that you're going down the list of things that you have to have and say, okay, do we have an agreement in place? Who's going to do what responsibilities? Who's going to be the specifications developer? Who's going to have that written down? That's going to probably be the foreign manufacturer. They have to be the specification developer if they're the 510K. You can't be the specification developer for them. Now it's no longer a private label agreement. And you need to figure out what is the process when a customer has a complaint. Who are they going to call, and how is that going to be processed? You've got to decide who's going to report. So any adverse events, any potential adverse events, those need to be reported. And even if it's not something that's reportable, you still need to notify the manufacturer overseas that this happened so they can take any corrective actions, CAPAs. And you really should have a good understanding of your quality management system. Even a lot of people are like, oh, I don't want a quality system. Well, a quality system is normally voluntary, but not in a regulated device. There's a reason for that because people can get hurt. So it's not a bad idea to have a quality system. And once you do have one, that opens up the doors for you to do other things that companies that don't have quality systems can't do. You can develop your own products. You can design your own kits. You can have a convenience kit that you register. So you have a bunch of different products that you assemble into a kit and sell it as a kit with your brand name on it. But each of those products are from different manufacturers. And you might be able to get some of those from a local manufacturer that's cheaper. If it's your brand and you design the kit, you can decide to swap out a component as well. If you're going with somebody else overseas is packaging everything for you, you're kind of at their mercy as to what they can get, at what price they can get it at. And you don't know how long they've had it, so you don't know what the expiration date is necessarily going to be. That might need to be part of your agreement with them, that we don't get any product that has less than this amount of an expiration date available. So little things to think about. But the most important thing, make sure you have an agreement, make sure you define who has what roles and responsibilities, and you have an agreement that includes things like liability and what's going to happen in terms of a recall. You don't want to be liable for that. You want the overseas manufacturer to be liable for that. I hope those help you if you're thinking about being a private labeler. If you have any additional questions about it, don't hesitate to ask. And thank you to the person that had put in the comment last week about private labeling, and I answered that, and that's why we did this session, to give people a little bit more information if they're interested in private labeling. So I hope this was really helpful. And if you have any suggestions for next week's session, please put them in the comments below. Anytime I do one of these sessions right afterwards, I look at any questions or comments people have in there, and I try to answer those. And I'm glad this was helpful to you. See you next week. Bye-bye.